Many people have side effects to statin medications or have been recommended to take a statin but haven't because they are concerned about the side effects. About 35 million people take statins in the United States, but research says only 55% of those who are recommended to take a statin are actually taking one. This is a big problem because research also shows those at high risk who are not taking a statin have more preventable heart attacks and strokes. This leaves many in the uncomfortable position of deciding if a statin's risk outweigh the benefits. This article will help you with the background information you need to make the best decision for you. So first, let's start with what are statins. Statins is a short name for cholesterol-lowering medications called HMG-CoA reductase inhibitors. They're called statins because each one of these medications' name ends with statin. For example, rosuvastatin, atorvastatin, simvastatin, etc. Statin medications are among the most prescribed drugs in the world. They are also among the most controversial. If you don't take a statin, you've likely heard or read about the side effects. Common stories about statins include that they cause liver failure, lead to memory problems, and a life-threatening breakdown of muscles called rhabdomyolysis. And there is an element of truth in these stories, but the reality is quite different than you may have been led to believe. The first step in deciding if a statin is right for you is understanding the risks and the benefits. So let's start with what are the benefits of statins? This is a critically important point to understand if you are considering taking a statin. Statins are among the most prescribed medications because they have a mountain of evidence that they lower the risk of heart attack, stroke, and death in those at high risk for heart disease. Statins may be the most studied medicine in medical history with more than 40 trials where statins were compared to placebo and shown to lower the risk of heart attack, stroke, and death in a high-risk group. Among medical experts, there is little debate these days on whether statins work in high-risk patients. The debate more commonly is how do we define high risk? In the statin risk versus benefits discussion I commonly have with my patients, the benefits are clear. In almost all high-risk populations, exceptions are those with kidney failure on dialysis or symptomatic heart failure that have been studied, those who took statins had 20% to 40% fewer heart attacks, strokes, and deaths over 2 to 5 years than those who took the placebo. So then what are the risks of statins? Like all medications, statins can cause side effects. In most research trials and in my clinical experience, side effects occur in about 10% of people taking a statin. Worrisome side effects such as liver inflammation. There's never been a reported case of liver failure due to statins. And life-threatening muscle breakdown are exceedingly and fortunately rare. In my 25 years of being a physician and prescribing statins for tens of thousands of patients, severe liver test abnormalities or muscle damage has occurred in less than 5 patients. Far and away the most common side effect of statins is muscle aching, also called myalgias. But whether this is due to the medication or the impact of our mind's negative expectations, called the nocebo effect, is controversial. Some studies have shown that side effects are about the same when a placebo is compared to statins. And based on this, some physicians feel that our minds and not our bodies cause statin muscle aches. Maybe this is right, but I have a different perspective for 2 reasons. Number one, I've had a lot of experience with people who have had side effects from statins. When I worked at Mayo Clinic, I half-jokingly said I saw everyone in the system who couldn't take a statin. I met many people who were desperate to take a statin because they believed the benefits but could not tolerate the side effects. And number 2, I also have muscle aching side effects to statins. Now it's possible for my patients and me the problem is the nocebo effect, but discounting the symptoms isn't helpful and doesn't make it any less real. So what if you have statin side effects? It's important to know that 90% or more of people can take a statin with no side effects. But if you're not one of them, here are 3 essential points to emphasize. Number 1, recognize our mind is powerful and the nocebo effect is real. If you're unsure whether your symptoms are indeed from the statin or not, work with your doctor to see if you can find a regimen that works for you. Number 2, just because you've had side effects on one statin doesn't mean others won't work for you. Different statins, dosages, or alternative schedules can be effective under a doctor's supervision. Statins are almost always safe. And number 3, ask your doctor if other cholesterol medications are an option. Both ezetimibe and the PCSK9 antibody medications have been shown to lower the risk of heart attack and stroke. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor.